The program you are about to watch is underwritten by Allergan Aesthetics, an AbbVie company. The views expressed therein are solely those of the doctors. Pluripotent stem cells, exosomes, growth factors, and cytokines. What's the future of the science of skincare? And so when we talk about all these big words, I mean, what are they really? You know, growth factors are these little signaling molecules that tell our cells to create new collagen, create new cells. And in the United States, we're one of the few countries where we can actually source these signals from human-derived cells, apply them on our skin, and tell basically our skin to create new collagen. But what do you think? I know, Ruth, you're so big into skincare.
And the truth is that stem cells have been around for a long time, and growth factors have been around for a long time, and a lot of people are miscalculating exactly which are which. There's no question about that.
Because no one's regulating necessarily what's in this and how much of what you need to create a clinical response is necessary.
And no one has ever really demonstrated that these products actually penetrate down to the cells.
Well, if they did, they might have to be regulated as drugs, not cosmetics, or not as over-the-counter skincare. And a lot of the companies don't want to make claims about penetration, because once you start making claims about changing structure and function of the skin, then you become under the auspices of the FDA.
And then a lot of companies do make claims that they shouldn't necessarily make about the skin.
Well, but the FDA, when they hear it, they come down on them.
But they make claims in beauty books all the time.
Right, because a lot of these products are big. I mean, ultimately our skin barrier is there to block things from being absorbed, and a lot of these molecules are quite large to actually get into the skin.
Do they need to, though? Or is it that signaling process that's enough? Do they really need to penetrate to have an effect?
What do you think, Ruth?
I think they have to penetrate. And I think the bottom line is, if you're using a growth factor, which is a very large protein, and you're not putting it on your skin first, you're probably wasting your time.
Absolutely.
And so people need to have an order of use. There's something that's very important. You just don't walk into a skincare salon and just buy everything because this does this and this is good for my eyes, and then you just put it all on together. There is an order of things.
So even if you apply it first, if it's a large molecule, how does that mean that it's going to penetrate?
It doesn't necessarily, but you can't be layering it on top of things that will block
because sometimes it does signal from the very top layer of the skin, the epidermis, to the dermis to start a cascade and start communicating. But I think with AI, we will reach a point where we can actually capture minute changes that are actually happening that we may not necessarily be able to capture with some 4-point or 5-point validated scale.
Well, there are studies that actually do biopsies and show increased collagen and elastin, and so we know that certain products over time will cause an increase in the actual substance.
For me, I'm still a retinoid girl, but just a little bit, because I live in the Northeast, so I like the microencapsulated forms of some of the retinoids, and I'll put that on, and that appears to build collagen. And then there's peptides, and some of them don't even penetrate into the skin at all, and they lay on the top of the surface of your skin, but they feel good. So there's things that actually do have some action, and there's things that don't have action. So patients need to differentiate between all that stuff with the help of a board-certified dermatologist.
And do you guys ever like use like a microneedling device or a laser to create holes and channels into the skin?
Yeah, but I just want to go back to what you had to say, which is that so if it feels good, even if it's like really expensive and it has all these different active ingredients,
I know where she's going.
Then why don't you just like put on like, you know, a lotion that costs 5 cents?
Right.
You know, if it's going to feel
that's what I tell my
good,
patients all the time about the feel-good products.
They don't feel good
because if there's a
they
peptide that's not penetrating, it's not worth it. I talk to them about that all the time. So I talk to them about using stuff that has actual science behind it that actually works. And that's why they need to come see a board-certified dermatologist.
There are studies that we can look at and describe to our patients that are meaningful in terms of what is actually going to have an effect.
Now, I want to ask you something, because you brought up like how you're layering on the products. So are you a proponent of having like 15 different steps that you're going to do to your skin, or are you like a simple person, or what are you suggesting to your patients?
I have at least 15 steps.
You do?
I do.
Wow.
But the bottom,
I have like 3.
but I'm also older.
Great skin.
But I'm also older than all of you, and so the bottom line right back
skin.
to our original conversation, which is it's never, if I think it's going to do something, I'm certainly going to use a topical ingredient before I'm going to have a procedure. That's just the way I feel about things. So yeah, should I have my neck done surgically? Absolutely. Will I? No. Not at this point. I never say no.
Right.
But the bottom line is I will try other things first because nobody really wants to have
And because
surgery.
we can. Today we can. And
And
technology
Sabrina,
is
I'm
just
with
getting
you.
better.
I'm with you on the 3 side of things.
Yeah.
Like maybe 3 products. I
Yeah,
just,
and then a bunch of laser.
I have
yeah,
my
and then a bunch of
Thursday night
laser.
Yeah, lots of
And then
Bunch of laser.
I have a new hair laser that's opening up the channels and dumping stem cells in. So there's all this cool technology. There's all these neat things that we can do.
And it's not just the skin, it's also our hair. I mean, we recognize that you can almost tell someone's age from their backside just by the density of the amount of hair. And I think that in that space, we're seeing more and more people using some of these injectable growth factors or injectable.
And huge changes are happening. Huge changes are happening with hair.
That
Yeah,
research is so solid, and it's
Right.
been going on so long. We are this far away from being able to clone hair, have stem cells for hair. So you just need one good hair will make you 10,000, and you'll have too much hair. It'll be your biggest problem.
Oh, I love
so,
that.
I know, I'm
I
so
love
excited
that.
about
Nothing
it.
like
But
the
it's
good
coming.
hair.
Give me too much eyelashes and give me too much hair where I want it, not where.
That's right.
Not where
It can't be
I
one of
don't
those.
want
It can't be one of those like genie. I have 3 wishes, and you say I want so much hair, and then all of a sudden you find yourself like Cousin It.
So I think we can all agree that the future looks very bright and promising. And although new medical developments can be very exciting, they can also be very deceiving and dangerous if not regulated. So make sure to always run all your questions by your doctor. Everyone needs to take care of their skin. Find out how on The Gist.